Breastfeeding for babies, for mothers, for families, for, for committees and the community, for the economy and countries are now well established by the research. There is absolute evidence that exclusive breastfeeding in the first 6 months is the most cost-effective, affordable, realistic, and universally practical child survival solution with solid scientific evidence. Optimum infant and young child feeding may prevent alone may prevent one-fifth of all child mortality throughout the world today. Exclusive breastfeeding is a divine blessing, the best start of human life on earth. And I think this should be treated as a basic right of every baby, every mother, every family, everywhere. Unfortunately, 3 out of 4 children are deprived of exclusive breastfeeding in the world today. I'm glad to inform you that exclusive breastfeeding rate in the first 6 months is much better than what it was in the global scenario. According to our demographic and health survey, 2 out of 3 children, that's about 64%, are exclusively breastfed in Bangladesh. In the last few years, we have improved exclusive breastfeeding. In the last few years, we have improved by 20%. Our status is better than many of our Asian countries. I believe our success in improving this exclusive breastfeeding rate and high immunization coverage have helped us for MDG4 prize, that reduction of child mortality that our Honorable Prime Minister received in 2000 from the UN. And we are really on the target for 2015 for child mortality and maternal mortality. Ladies and gentlemen, Bangladesh is one of the first few countries who passed breast milk substitute or BMS law for controlling marketing behavior of the formula producing countries. Our law was historically read as next to the best by International Breastfeeding Action Network or IBFAN. I am pleased to let you know that this evening that we are further improving of our BMS law to make it more better, and the process is almost complete now. I am also proud to inform that Honorable Prime Minister of Bangladesh, Her Excellency Sheikh Hasina, took a personal initiative to make paid maternity leave for 6 months for the mothers for the poor of children. We have a national IYCF strategy action plan in place. Our government in Bangladesh is providing maternity allowance to 100,000 poor mothers throughout the country. I repeat, we are providing maternity allowance because this is the below poverty level mothers, and we are providing them allowance. There's about 200,000 people. This helps families to have a little more nutrition in the family and to the mother. Ladies and gentlemen, I have joined you today not to tell you only our success stories, but to revitalize our commitment to ensure universal, exclusive breastfeeding. It is not an impossible target. Let us realize collectively what has been done for promoting and protecting breastfeeding so far, what needs to be done, and how it could be done in the future. It is not unusual that many doctors, nurses, and health workers and policy leaders are not adequately equipped with knowledge and skill for promoting, protecting, and supporting optimum infant and young child feeding. We must have to further strengthen the training and communication program on IYCF. I must emphasize on equality of training here. Apart from training for professionals and the member of the civil societies, we have to look further in cooperation of infant and young child feeding in medical, nursing, and school curriculum. About the protection of families from aggressive marketing practice of the companies, we understand having a strong law is not good enough. Enforcement is the key issue. We must work together. Our clear and loud message to the industry: they must have to fully comply with the international code and the national regulations. Infant feeding industry is a powerful billion-dollar business all over the world. I have nothing against the business. All we are going to say that let us work together. Let us see how we can make the babies better, mother better. So what Dr. Gupta was saying, that we just have to follow the regulations and they must comply. We must have to enable families for successful breastfeeding. 6 months paid maternity leave may be very helpful about this. But so many countries are yet to ensure at least for the 4 months paid maternity leave. Women employed in formal sector and are beneficiaries of the maternity leave. Now we have to think how we can bring similar benefit to women who are working in sub-formal and informal sector. There are some industry channel options. There are some industry channel options on the table. We must have to review them very cautiously. For the sake of substantiality, suitability, and affordability, simply we prefer routine nutrition solution to come from the family pot, not from the family community garden and from the community garden, and not from any pot or any packet. Thank you. I will repeat this very important paragraph. There are industry options are open on the table, and we must have to review them very carefully for the sake of sustainability, suitability, affordability, and simplicity. And we prefer nutrition solutions to come from the family pot and from the family garden, and not from any pot or not from any pack. Ladies and gentlemen, there is no alternative but to promote, protect, and support exclusive breastfeeding in the first 6 months and optimum complementary after that. We want our program succeeds over time. We need to learn from our past, which program worked and which program did not. Questions raised about the effectiveness of baby-friendly hospital initiative, and I believe the baby-friendly hospital initiative was instrumental in bringing our massive change in the hospital practice. However, we need to review every program routinely to fix any problems that there are. Ladies and gentlemen, we want sustainability of our IYCA program. We want results. Innovation, we must be held responsible for our action and for patrons who support us with their many technical resources and labor as they deserve. My humble submission to this audience of our distinction phase strengthen more of your commitment for the cause of IOICF program and for the cause of our babies and thereby for cause of our future. My friends here, my final call to you, please let us join hands together so that we can ensure universal, exclusive breastfeeding of optimum infant feeding. We must do our best to deliver results. We must bring on board every stakeholder there may be. Thank you all. Thank you.